Doesn't matter.
Maybe not, but go for it.
Good afternoon, everyone. How are you today? Beautiful day out there. Got several things that I want to talk about today. Of course, we're going to begin by talking about COVID, the numbers. We are also going to talk a little bit about yesterday's elections. And then finally, we're going to talk about rental assistance, mortgage assistance, evictions, in our efforts to keep people in their housing. So, the numbers from yesterday with regard to COVID are the city of St. Louis had 73 new cases, and as you know, these numbers are bouncing around. Number of people in the hospital yesterday and is 286 of confirmed COVID. 70 people in the ICU. That was down a couple from the day before. 34 people on ventilators, and again, that number has been running right at 30, 32, 34. 55 people were admitted to the hospital yesterday, so that number is up. It's been running between a high of 56 and a low of about 32, it looks like, in the last week. So 55 is on the high end of that. Average 7-day patients admitted averages is at 43 right now. So our COVID numbers are in the city, and in those hospitalization numbers, I think you know, our regional numbers are continuing to tick up. In the city, we are continuing to work with any bar, restaurant owners, any event spaces where we get a complaint that perhaps people are not using masks or social distancing, and so we are contacting those folks, trying to bring them into compliance. And that's about it. Our numbers are continuing to tick up or stay a little bit stable. If you follow the pandemic task force daily, and they'll probably have some new numbers here in about an hour or so, but if you follow them daily, you will see that I think yesterday's headline was that things are stabilizing, and we believe that's the case. They are stabilizing at a little higher level, and so we are continuing to watch that. So that's COVID, and of course, I know you'll have questions, and we'll take questions about COVID as soon as we cover a couple of other topics. So yesterday was election day. I hope you all voted. We talked about that on Monday. A lot of people did vote. That's good. The city had about a 40% voter turnout. I'm looking for my number here. I guess I don't have it in front of me, but that's about right. And let me just say thank you to the election board and to the hundreds, literally hundreds of people who worked the polls yesterday, both inside the polls and outside the polls. Election day really went pretty smoothly, especially considering all the new procedures and protocols that were in effect because of COVID. And so this is a good practice for all of these things for the November election, which now is about 90 days away. And of course, November elections always have a much larger turnout than August elections, even though there were a number of contested races yesterday. So over 10,000 absentee votes were cast in this absentee and mail-in were cast. That's up considerably from usual, and that, of course, is because of COVID and because of the opportunity to have mail-in voting. So the election board did a great job in the city of St. Louis yesterday. 99 polling places. Have to get all the equipment to all of them, get it all set up, and they did a good job yesterday. All of you who went and voted did a great job too. So let me just say congratulations to all of the winners yesterday. And frankly, congratulations to everybody who had the guts to put their name on the ballot, to knock on doors or call on the phone to beg your friends for money as a candidate, and to expose and talk about your own beliefs and take the inevitable criticism. Inevitable, I say inevitable because particularly in this very polarized political environment that we have right now in our country, there's a lot of criticism. So thank you to everybody who put their name on the ballot, who put themselves out there. Just know that most people will never do that, and because it's hard. So thanks to all those candidates. Now, let me just say thanks to the winners from yesterday, and I'm going to name a few in the folks who were in contested races. Congratulations to Cori Bush, who won in a tightly contested congressional race. Congratulations to Kim Gardner, who, and when I say won, she won the primary, and of course we know there's a November election, but we're saying won yesterday. Congratulations to Kim Gardner, who is winning a second term as our circuit attorney. Congratulations to Sheriff Vernon Betts, also an incumbent. Congratulations to Tashara Jones, who won for treasurer, also an incumbent. In contested races, congratulations to Steve Roberts, who won yesterday as the Democratic nominee in State Senate District 5. And so that was about a 5-way race, so congratulations to, he's currently Representative Steve Roberts, who will now be on the ballot in November to be 5th District Senator. 2 contested races on the state rep seats yesterday. Congratulations to Marlon Anderson, who won in 76, and to Kimberly Ann Collins, who won in 77. So thanks to everybody for doing that. Excuse me. One big thing that passed yesterday, Medicaid expansion passed in Missouri. And we are now the 38th state. Missouri is the 38th state to pass Medicaid expansion. That will mean a lot of jobs, particularly in the healthcare industry for Missourians. And it will mean coverage for individuals who make under 18,000, families of 4 who make under about 36,000. So glad that that passed. Excuse me 1 minute. Okay, I'm back. So the last subject I want to talk just briefly about before we take your questions is a subject that we've been talking about for a while, but we had a lot of questions about this on Monday. You all know, I think, that the city has set aside $5.4 million for rental assistance and mortgage assistance. Our goal, of course, to keep people in their homes. We have had, for that $5.4 million, we had 4,500 applications. Now, interestingly enough, when we got to looking at those applications, about 1,500 of them were for people who lived in the county. So we had to refer them to the county. That left a little over 3,000 people who so far have applied for mortgage or rental assistance who live in the city. What's happening there is that those individuals, we're going to send an email out, maybe today or tomorrow, that just says, we got your application. You're going, Department of Human Services is going to refer your application to one of about a dozen agencies that we're contracting with. Now, these contracts are not all firmed up yet, but let me look for my list here. Now, don't call these agencies, please. It's just going to slow down the process. But these are agencies like you might expect: the Urban League, Catholic Charities, this isn't all of them, International Institute, Paraquad, Park Central, Mission St. Some of these folks are going to be taking applications. So rather than have just one entity be able to work with 3,000 people, we are referring those individuals to an agency. You won't know yet who you're referred to an agency, and that agency is going to contact you to work through the documentation that's needed in order to get your rental or mortgage assistance. So that's how that's working. But it's noteworthy, I think, to stop and say that hopefully you all know by now that evictions in the city of St. Louis have now been stopped, halted, paused, until we see whether or not we can help anyone who's in the process of being evicted, if we can help them not be evicted through rental assistance or mortgage assistance. Yesterday or the day before, I think it was, there were 44 people, families, individuals, who had tentatively been scheduled to be in the eviction process. At that time, only one of those 44 had applied for rental assistance. So what we're doing is we're working with the courts to mesh these two, the folks that are in the process of the eviction process, to mesh them with our rental assistance, mortgage assistance program, to see if we can't bridge that gap and keep people in their housing. So that is all a process of applying, working with an agency, making sure we don't evict someone. And when I say we, that's really the sheriff who has to do the eviction. The courts decide who will be evicted, and the sheriff has to carry it out. But we're trying to bring these entities together to make some sense out of this and keep people in their houses, in their homes. So those were the three major subjects that I wanted to talk about today. I'm happy to take questions about those subjects or whatever's on your mind.
A few questions, Mayor, starting with a couple of things about COVID-19. So, question about, of the people you mentioned that are in the hospital or going in the hospital, do we know if these are people who are sick from the city or coming from St. Louis County?
We don't, because we're unable to get that information from the hospitals. You know, what we know, I mean, some of them are probably from Illinois. Some are probably from St. Charles or Jefferson or Franklin or even further out in rural areas, because our hospital systems here in St. Louis City, St. Louis County and surrounds, you know, we provide the majority of the acute medical care for a pretty big catchment area. So no, we don't, because we don't know who's in the hospital or what their home zip code is. So
there have been widespread reporting about testing delays, some results taking up to about 10 to 14 days. Is there something that the city or the health department can be doing or are doing to try and accelerate that timeline?
yes, so we're working with the labs, and frankly, it's gotten better in this last week or so as the labs caught up. But we are working with the labs and we're working with the state to get the information directly as quickly as we can. Because obviously, if you had a test taken, you need the results quickly. You want the results quickly. And by the way, I want to remind you that if you have a COVID diagnostic test taken, we really are recommending that you self-quarantine until you get the results back. It's not a hard and fast requirement. We know it's not sometimes not completely possible. But if you felt the need to have a test, then you ought to wait to see the results of that test before you're really out and about. So reminding you of that. And the test results are coming back a little quicker. And of course, it depends on where you have the test. If you have the test because you're going in the hospital for some procedure, well, that test is going to come back very quickly. If you have the test because you just want to know, you're feeling fine, but you just want to get the test. I know there are a lot of people who are in that category. Then those tests sometimes take a little longer to come back. So close your circle up, self-quarantine as much as you can during that time that you're waiting for your test results, because the result that you get, let's say it's 4 or 5 days later, it's going to tell you that you were either positive or negative. Let's say it says negative, most of them do. You were negative on that day that you had the test. So if you had the test on Monday and you find out on Friday that you were negative, what it says is, well, on Monday I was negative. It doesn't say on Friday I was negative. You understand that, I'm sure. So it's a point in time.
We have a couple of folks asking about parks, Mayor. Some parents noticed that tape is not necessarily always getting replaced around the playground. So what is the status about parks and playgrounds right now in the city of St. Louis?
Playgrounds are not open, and I know it's rough, and I'm sorry about that. We have 109 parks in the city. Our Parks Department does replace the tape, the yellow tape that's around playgrounds, but that's a lot of people are taking it down, and they take it down just about as fast as we can put it up. So I think they're doing it a couple of times a week now, rather than being at a playground every single day, because that's manpower. And honestly, we need, we got to cut grass, we've got trees to trim, we've got recreation, we've got a lot going on, and that takes a lot of manpower to have to do every playground every day. So just know playgrounds are not open. Don't have your kids play on them.
On hospitalizations, Mayor,
Mm-hmm.
as people are going in, are there or how many individuals are also being released at the same time, and what impact do you think that has?
Well, yesterday there were 41 people who were discharged. And these run a couple of days behind hospital data. And then there were 20 the day before that, and 21, and then 42, and 41, and 49, and 43. These are daily numbers. So I think what you see here is that there are more people discharged on weekdays than weekends, usually, because you can see a little trend in this data. But we're releasing, the hospitals are releasing, between 40 and 50 people a day from the hospitals. So that's good. There's a couple things that are keeping the total number of people in the hospital down. It was 286 confirmed COVID cases. We talked about it a minute ago. Folks going into the hospitals, there's better treatment. We know more now. The hospitals and the doctors know more now about how to treat COVID than they did 3 months ago. So the stays are somewhat shorter. The stays are also shorter usually for people that are younger. And we know that people that are older, people in their 60s and 70s and 80s, are sicker, they have more underlying health conditions, they stay in the hospital longer, and they have worse outcomes. So as you all know, because we've talked about it every day, the majority of the people that are being diagnosed with COVID are in their 20s and 30s. Those are the highest numbers. That was not the case 3 months ago. 3 months ago, it was people in their 60s, 70s. But now, it's young people in their 20s and 30s. And so they are usually in better health and don't have as severe symptoms. So,
A few questions along the lines of, if hospitalizations and cases continue to go up, or if numbers continue to go up, will there be additional orders issued, restrictions, and will all schools be ordered to go virtual?
if numbers continue to go up, yes, there probably will be additional restrictions. And what we have done, it is really and I think you've seen this across the state and even in St. Louis County, most schools are beginning virtually, or at least in part virtually. And we think that is, Dr. Eccles would recommend virtual at this point in time, primarily virtual, keeping groups small, keeping relationships small within the schools. So St. Louis Public Schools has already announced that they are doing that. Now they are having instructional support centers that are open for kids who need a place to be during the day, but they will still be learning virtually even if they are at the instructional support center. There'll be tutors there, there'll be food there, there'll be buses. But it's not a group situation, it's an individual situation.
We've got time for 2 more questions. Diane's question, Mayor, if customers say they don't want to wear a mask, like at a grocery store or a business, are businesses held accountable for enforcing mask wearing?
They are pretty much, and that's a very tough position to put our businesses in. But our health inspectors can't be in every store every minute of every day. Our police can't be in every store every minute of the day. So it really does fall to the businesses to give out masks, to remind people to wear a mask, and to wear it right over both your nose and your mouth. It's a very tough situation, which is why, of course, we're trying to communicate one-on-one with as many people as possible, so that to persuade you just to do it, rather than having to be reprimanded or whatever. But yes, businesses have to make a good faith effort to make sure that their customers are socially distanced and that they're wearing masks. I mean, that's why businesses are able to stay open, because the condition of being open is social distancing and mask wearing. Now, I want to say along these lines, I had someone contact me, I don't know, a day or two ago, to ask me to talk about churches and funerals and weddings and all that, and just to remind people that we know they're not businesses per se, but the rules for general businesses apply to church. It should be every other pew. It should be at least 6 feet apart. It applies to funerals. It applies to weddings. It applies to wedding receptions. So really, those events should be kept as small as possible, and they just have to be socially distanced. And it's very, very difficult. I understand that it's very, very difficult, but it is complying with social distancing and mask wearing is the reason that we're allowing those events to continue. And so it's tough, but you got to do it.
Okay, we have time for one more question. Last question. Gwendolyn's question, Mayor. Does the city of St. Louis have any travel restrictions for people coming into the city from other states or areas?
We don't. I know that there have been some states that have said you can't enter that state from a neighboring state without quarantining. We do not have that. We are really in a very mobile world here, and I can't imagine if we said I can't imagine that we would ever say you can't come into Missouri from another state. When you think about your two largest cities are on state borders. Illinois here in St. Louis, Kansas over in Kansas City. People work across state lines. They have family that's across state lines. So I know there are some people who have emailed me and thought that would be a good idea, but you got to think about how would that work. So no, the state of Missouri and the city of St. Louis do not have any travel restrictions on people coming in from other states or cities. So
that's all the time you have.
That's all the time we've got for today. Thank you all. Appreciate you being with us. I hope that the COVID information is helpful to you. The election information, maybe you all already knew all that. And then the housing assistance, rental assistance, and eviction pause, the stop in evictions. So our goal is to keep everybody in their housing. So thank you all. We'll be back and talk with you on Friday. Thanks.